The following segment is sponsored by Munson Healthcare.
Prostate cancer is the second most common cancer among men, but 90% of all cases are curable if detected early. That's why with September being Prostate Cancer Awareness Month, I sat down with a radiation oncologist at the Cowell Family Cancer Center in Traverse City to talk about screening and what treatments are best.
The key to success in the treatment of any cancer, and specifically prostate cancer, is an early diagnosis. And an early diagnosis means screening.
Dr. Douglas Brown, a radiation oncologist here at the Cowell Family Cancer Center, says screening for prostate cancer starts with a primary care physician.
I think one of the most important messages I can give to patients and their families is to see your primary care physician and talk about screening. Most men with prostate cancer do not have symptoms, actually. Most of the time it's found by a digital rectal exam or an elevation in their PSA. There are some patients who do have symptoms, and the common symptoms are usually related to the urinary system.
7 and 4's Storm Team Chief Meteorologist Mark Watkins is a patient of Dr. Brown's and was diagnosed with prostate cancer in August of 2017. He's had treatments to get rid of the cancer, but credits his regular screenings for catching the cancer early on.
Well, for years, this little number called a PSA number for guys, it looked a little high, so I've known about it for years. It was a little high. Now, when it gets too high, they want to check you for prostate cancer. It'd be 10 years maybe before I really feel some damaging problems. But no, I wanted to take care of it, so I went through the process.
Mark underwent treatment at the Cowell Family Cancer Center.
What they describe as like acupuncture. They took little needles, poked them into my prostate, and put some pellets in there that slowly dissolve, but they're radioactive little pellets that would start fighting the cancer.
There's a lot of different treatment options for prostate cancer, and one size doesn't fit all. And we try to home in on what are the best treatments for the individual patient.
Mark went back in June for radiation and is now looking ahead to October for his next follow-up. So far, he hasn't had any side effects from the treatments. He does have a message for other men.
As a guy, you need to do your homework a bit, and you need to understand that if you do not take care of this and you have a problem, it'll eventually kill you. It's cancer. But it's very easily beaten in early stages.
It's very important to start, talking to other men, talking to your brother, talking to your father. Next year, roughly 180 to 200,000 men will be diagnosed with prostate cancer in the United States. So it's a very common diagnosis, and fortunately, if men are screened and it's found very early, it's one of the most curable cancers.
To learn more about the latest screening and treatment options for prostate cancer, there will be an open house at the Cowell Family Cancer Center in Traverse City Wednesday, September 19th. Mark Watkins will also be there to talk about his own diagnosis and treatment. I have all the information posted about this event on our website, upnorthlive.com. In the studio,